Caregiving for a family member or friend affected by a chronic or long-term health condition is an important public health issue affecting millions of people. As the need for family caregivers grows, it's critical to understand and respond to the physical and mental health burdens they face. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association, and a podcast that you've rewarded with 100,000 listens in 2022. Thanks for your support. I'm Tom Hedderly with AHA Communications. Nancy Myers, Vice President of Leadership System Innovation at the AHA, leads a four-part series of discussions on hospital and community partnerships to support family caregivers. In this episode, Nancy is joined by Maureen Hodge, High-Risk Program Manager, and Janice Aharon-Ezer, Clinical Program Manager, both from Community Memorial Health System in Ventura, California. The discussion defining the roles of family caregiver, understanding caregiver needs, and offering help.
Welcome to everyone who's listening to us today, and welcome especially to Maureen and Janice as we begin our discussion about caregiving. Tell us a little bit about yourselves and how you became involved in caregiving as part of your professional life. Maureen, let's start with you.
Great. Well, I'm so glad to be here today with you all. Really, caregiving probably started more officially with me, with my mom who had Parkinson's. And we were a big family, but had to rotate. And I'm a professional. I'm a licensed clinical social worker. I've been in a hospital setting for over 10 years and in the field of social work for over 25, working with caregivers all the time. But then when you're faced with it on your own, you kind of feel frozen yourself. And it really brought me back to this place of, oh my goodness, I'm a professional. I can help lots of people. But when it hits home, it is at a different level. And how do we do this better, especially with our medical community? So now we find ourselves, which you'll hear shortly about our hospital caregiving program. And it was just such a great fit. So I feel like as a hospital health system, we are really proactive in wanting to care for our caregivers. So that's kind of how I landed here now today. Yeah.
Great. Janice, how about you? Tell us a little bit about your background.
Well, I am very happy to be here today, and I'm thrilled that we're talking about this topic of caregiving because it's so important. Like Maureen, I also have my own personal story of caregiving with my mother, which I'll tell you about a little bit more about later. And I didn't know I was a caregiver, and I'll also talk about that a little bit later. I'm a licensed marriage and family therapist with over 30 years in the field and a specialization in family therapy. And even though all caregivers are not family members, it's just fascinating to me how the roles play out with caregivers and patients. And doing this work has proven to be I'm just very honored to work with patients and caregivers. I have a huge level of respect for caregivers who are dealing with so many things that most of us don't even know about, and their ability to do that is really amazing to me. So I'm very honored to do this work.
Really appreciate both of you and the work that you're leading. So Janice, I'll start with you. I came across a recent report from the National Alliance for Caregiving that talked about an increase in the number of caregivers in the United States of 9.5 million between 2015 and 2020. It also pointed out that unpaid caregivers, so people that are doing this work but not as part of the healthcare system, encompass more than 1 in 5 Americans, which is astounding when you think about it. So talk about, you alluded to this just a moment ago, who are the caregivers that are out there and what is their role? What are they doing?
Yeah, well, I'm so glad that you asked that question because one of the things that we've really learned here is that we need to, in our country, break the stereotype of who a caregiver is. If you look at pictures anywhere that seems to imply a caregiving patient relationship, it's most likely going to be an elderly person taking care of an elderly person, or a younger person taking care of an elderly person. And what we have found is that this role of caregiver encompasses everyone. A caregiver can be a mother, father, sister, brother, husband, wife, extended family member, or a friend or a neighbor. So it encompasses everyone of any age. Our experience tells us that age, race, sex, culture, and socioeconomic group is very, very broad. And so the pictures that we put out in our communities about caregiving really needs to change, because I think it drives what we think of as who needs help and who's helping whom. So it's a very, very diverse group of people. And, they're taking care of people with a lot of different problems. Most generally, people are thinking of medical problems, and with older people, possibly dementia. But we are dealing with caregivers taking care of patients that have medical issues, psychological issues, substance abuse, and also developmental disabilities. And our caregivers that we work with may have their own challenges. They may have some very complex medical issues themselves or psychological issues, and yet they're still caring for people that they care about in a very significant way. And they're not necessarily a family member. So we really need to broaden our vision of who is a caregiver and really also who is a patient.
That's really helpful. So, Maureen, as Janice talked about, caregiving is not just about taking care of folks with medical conditions and physical disabilities, but also people who have behavioral health needs or cognitive health needs, with so many different types of care being provided by these lay or at-home caregivers who aren't trained as healthcare professionals. How can they prepare to serve in these roles?
So, Nancy, I think that's a great question. I think when somebody in a hospital setting, in a healthcare setting, suddenly recognizes my mom needs full-time care all of a sudden, she's leaving the hospital, and a person has to step into this role that they have no idea what's coming at them. And it could be something where it's an acute crisis, or it could be something they have a chronic condition that now they just need more help. So, in part, I think the roles really have to be looked at as a family perspective. If they have a family, everyone maybe coming together, talking together. How does this look as a family? We recently just had somebody who had no family, and literally the neighbors were caring for the person. And so this, that's another level. You have so many different people that enter this world, whether it's in a family member or a neighbor, that all of a sudden the patient needs help and care. And so preparing for these roles, I think, is a lot of communication, talking with providers, talking with the family members or the neighbors who are deciding what level of care can they provide, and then being realistic about that. And along the way, so much of the behavioral health, both for the patient and the caregiver, comes into play. Cultural dynamics come into play, how they've grown up, how their own culture seeks to have to care for the patient, or say, you know what, they're on their own. Every culture really deals with it very uniquely and differently as well. So communicating, using the social worker at a hospital, using in our hospital system, we have a caregiver navigator now, being able to use the resources available to you. And every city, has an area. Well, I would think every county has mostly area on aging. There's different places that people can get help to help them understand what their role is and to get some guidance.
Yeah, and you raise such great points that caregiving can be ultimately so rewarding. To be there to help a loved one or just a friend who's in need, but at the same time, it can be just bone chilling, exhausting, both physically, psychologically, emotionally, and financially for folks. And I suspect that you see a lot of caregivers who really are struggling with taking care of themselves across those dimensions while they're providing good support to the individual that they're working with. So, Janice, tell us what you're hearing from caregivers, about that, and how are they attending to their own needs, and where are you seeing opportunities to help them?
Well, we really see this Caregiver Navigator program as definitely fitting under the umbrella of behavioral health because the real focus, it definitely helps the patient. It is about avoiding readmissions to ER and the hospital, but the actual focus is on the caregiver. And I will tell you that it takes some time for caregivers to accept that shift because they are so used to the focus being completely on the patient, that I find myself discussing over and over with them about themselves. And as Maureen alluded to, if you're dealing with a caregiver that already has depression or anxiety as part of their behavioral health makeup, or people that have had a lot of trauma early in their life, this role of caregiving is a lot more challenging for them. So it is about the mental health of the caregiver. And I will say that the common denominator that I find is as the caregiver navigator to really connect with people, that is in and of itself healing. I definitely provide people with resources, but that is not the main thing or even the most important thing I do in most cases, because most caregivers feel very alone. I told you I didn't realize I was a caregiver. So most of these folks don't realize they're a caregiver. And guess what? Neither do other people, even their sisters or brothers or, their friends or neighbors. So people don't really know what you go through. And our caregivers are in many different situations. They can be a caregiver in a very acute situation. Imagine someone who gets into a car accident and is very, very seriously injured and comes out of it with some very serious injuries that need caregiving, or someone who has a very serious heart attack and ends up in the ICU and then comes home. So imagine that scenario, which is very acute and sudden and shocking, to someone who has a debilitating disease like Parkinson's or advanced rheumatoid arthritis, or someone who is taking care of someone with Alzheimer's. Those are progressive, those are the marathons of caregiving. So there's, acute, there's long term, and people get into very different situations with that. Another issue is where the caregiver lives. I work with caregivers across the country. We're here in sunny Ventura, although not today because it's raining. But, I work with people, caregivers that are on the East Coast or somewhere in between. So a lot of it is telephonic, and a lot of it is that they're the long distance, more peripheral caregiver, where if patients have people living here directly, there are people that can come over, like Maureen was saying, and give people medication, can handle the checkbook, can do those things. And so those caregivers, depending on where they live, what their mental health status is, what kind of patient situation they're dealing with. And I also want to add the relationship between the patient and the caregiver. With family caregivers, not all families are close or have had super great relationships, and that also complicates the caregiving. It's difficult to take care of a parent or a child or a loved one when things have not been so great in the past. So I'm just highlighting these variables because they're really important and they really affect all the aspects of being a caregiver and a patient.
Thanks. So, Maureen, with that as the backdrop of all of the issues, or at least a lot of the issues that caregivers faced, what was the motivation for Community Memorial to focus on this issue? And tell us about the genesis and then, the structure now of the Care Navigation Program.
Yeah. So, we live in a really unique community, really proactive. We are from Community Memorial Health System in Ventura, California, and we have 2 acute care hospitals, 22 outpatient clinics. And in 2019, there was a community health needs assessment that took place. And out of our health needs assessment, they really found that our caregivers are in crisis, and the number of people needing caregiving in our county is going up so much. And where are we caring for the caregivers? And so out of that, a team of people came together from a unique, diverse group of, entities and said, let's do something about this. So 3 acute care hospitals in our county, a nonprofit, our community foundation, nonprofit, and another CBO, community-based organization, all got together and said, what can we do? And we started this pilot project called the Caregiver Navigator Program. We were modeling it after another program that was really successful about an hour from here, Santa Maria, California. They had started it and seen amazing results. And so the community foundation said, we're going to fund you. And each hospital started the program very differently. Each of us, we decided our program was going to be based in our outpatient. So anyone who's a patient in our outpatient clinics, if there was a stress, if there was a need from the primary care doctor, they could put in a referral. Another hospital, Dignity Health Hospital, said, we're going to just do it right out of our outpatient services. So or inpatient hospital, each one did it a little bit different. And the focus was to decrease readmissions, both for the caregiver and the care recipient, improve the relationship with the physician, and overall decrease the anxiety and depression of the caregiver, as well as increase their overall resiliency. And we wanted to see, can we move the needle? Can we see that readmissions are decreased? And so our local university helped us do a pre and post test. We're into our year 3 now, and the results right now are showing that readmissions for both the caregiver and the caregiver and the patient have both gone down. Across the board, all decrease in depression, anxiety, all have gone down. The increase in resilience has gone up significantly. So we are so excited because we are seeing how this program across our system and in another 2 hospital systems are all seeing the same results, that caring for the caregiver really helps the caregiver do a better job with their patient and their loved one. And so it's all helping the hospital, of course. And one of the other kind of unique pieces of this is that the caregiver feels so much more connected to the hospital system, to the physician. They feel like they're being heard at a different level. So I think that's all these little parts that make a big difference in the outcome for the patient. So that's the genesis of how this got started. And now our hospitals really, Community Memorial has just said, hands down, we love this program. We're committed to it. Dignity Health has said the same. Up in Santa Maria, California, they're saying the same. So we've seen good outcomes and excited to keep it going.
And I love that you talk about that partnership aspect, that it's not just your organization acting alone, but rather in partnership with other hospitals and health systems, as well as community partners. And, this past year, you and your team, including your community partners, participated in the AHA's Hospital Community Collaborative, which is designed to bring hospitals and community groups together to address critical community health needs like caregiving support. How did the HCC program support you and your community partners in the work that you were doing together?
Yeah, great question. So our Ventura County Community Healthcare Collaborative really was like the place where all of these groups came together. And out of that, we kind of as a team joined the HCC with the focus on the caregiving. And what was unique to me is in the hospital world, hospital entities, we're good at talking to each other and really trying. I mean, we in our county really work at that. Like, I think our Hospital Community Collaborative is really unique. We have public health on it, so many great hospitals, organizations. But one of the things that is easy to leave out are all those community partners. So with the HCC program, it really allowed me to kind of take it to another level. Like, I feel like the first collaborative is strong, but that next level of where are all our community partners to help know what's going on? How are we talking to them? Because in the program itself, we're working with our caregivers all day long with community partners and helping them find the resources and getting them connected to whatever it might be, transportation or a caregiving class or whatever it would be. So the HCC really allowed us to brainstorm at another level to just increase that circle. And so as a result, we started the Caregiver Collaborative. I feel like all these people had been doing all this work, but no one, well, some of it did. People still got together, but I feel like it just brought people together in a different way. And now we know each other better. I mean, COVID had challenges, But now it's just, we're doing legislative work together. We're working with our area on aging at a different level, really making a difference. We started the master plan for aging in California. That collaborative has a real strong voice to what we're doing in our state for caregivers. So it just upped the ante. And I think HCC for me really helped me be kind of that facilitator to move it and at a different level. So we are so thankful for how that supported us. It's really tremendous.
Oh, and we're grateful for the work that you're doing in the community and that folks are doing across the United States in their communities.
And I just want to say one thing. I think on a specific level, the work that Maureen has done, amazing work, it's helped everybody get more organized, because it's not unusual in a community, at least our community, where people that are serving the same sort of population or same issue, we don't all necessarily know about each other and what each other is doing and how to refer to each other. And if we don't know that, how are we going to really completely take care of anyone? So this brought us together with a better idea of, are there duplication of services? Who's doing what? How do we refer? And then, during COVID, there were a lot of programs. For instance, senior meal program in our community. Dinners were put together and cooked at local restaurants. They were really great. It was free for months and months and months, but that changed now. We're not in COVID. And so things kind of come and go, and you have to stay on top of them, because caregivers get they're exhausted, and they get very tired trying to fish around and find things. So it's easier to really present up-to-date, clear information about what's available in our community. And it's very helpful.
Yeah. And all these community-based organizations, county, nonprofits, all really are together in it. And I think that has been one of the greatest perks, is to see how our community has really embraced how to care for the caregiver. So it's been really, really special.
That's wonderful. What a great health ecosystem you've created around caregiving.
Mm-hmm.
So in just the last couple minutes that we have, I'd ask Janice, we often ask at the end of these podcasts about what's your view from that Monday morning quarterback chair. So, what's your advice to other hospitals and health systems that are interested in developing a similar caregiver navigation program? Or do you have any gems of what folks should do or maybe shouldn't do as they're considering that?
Yeah, well, I think it's really important to start with the right person, that right seed. And that person, I think, needs to be a licensed LCSW, psychologist, licensed marriage and family therapist. I think a specialization in family therapy is very helpful, because a lot of things come up with that. And so with those trained professionals, I think they have a very good idea of how to assess and really figure out where to intervene with things. So I think hiring the person is the best thing to start with. And then the other thing that Maureen has so wonderfully worked on is, it's very simple, but not necessarily always easy. Find out who in your community is working on these caregiver issues, and really reach out to them and build a coalition, so that you're able to do some of the things we just talked about with the referrals and support. We also started a caregiver consortium, and so once a month via Zoom, all the caregiver navigators, and there aren't many of us, but across our small part of the state, we meet to discuss issues, because it's a very unique position. There's nobody else in the hospital that has this position usually. The caregiver navigator is the only one, and we need to support each other, bring in new ideas, discuss cases. So it's a support for us caregiver navigators.
I would just add to that that Janice is doing the micro work of how important this is, and making the connections to the doctors. I mean, she's tasking, emailing, our internal systems all the time, and then that outer system. So really, promoting it in our hospital, I think, has been a great way for doctors. And then they know Janice, and then she does such a great job that they feel connected as well. And then they need extra help. They know we're having a problem with, Fred and his issues. And it's a really fluid relationship between the provider and Janice and the patient. So knowing who the providers are and working with them, letting them know, and then the administrative side, getting your hospital on board and recognizing the value has been amazing. I think we see the value, and over 3 years, it's like this has to be embedded in our hospital forever.
I think thinking very carefully about how you want to design the program. Our program is very kind of concierge level because we're dealing with patients that are patients of ours in our 22 clinics. And that gives the caregiver navigator the ability to go to appointments with patients if they want to schedule things, to directly speak to the physician, to have access to their records. So you really can help in a more strategic way. So I think it's important to think about how you want to design the program.
Well, and with that, I think that we're at the end of our time for this podcast, and I want to thank you both for your time and expertise today, talking about both the urgency behind caring for caregivers and your Caregiver Navigator program. There's so much more to discuss and examine related to this growing issue and opportunity in the U.S. In our next episode, we'll take a closer look at the role of the hospital community partnership to support caregivers and the different kind of services that are in demand. Thank you, everyone, and have a great day.